Hello.
Hello, everybody. I am Dr. Kim,
And I'm Dr. Krista Burris.
and we are Coachella Valley Direct Primary Care, and today is our COVID update show for
August 11th,
August 11th.
2021. This better be the last August that we talk about this. That's kind of how I'm feeling.
Well, how are you doing today?
I'm doing good. It is not a horrible weather day here in the Coachella Valley, so that it's not cool, but it's not oppressively hot.
Right.
So
Still humid, and it rained last night,
yeah,
I believe.
it's kind of weird. Like it's like we're trying to have a monsoon season or something. How are you?
Good, other than being a little humid. Today's not too bad.
Hmm.
Stock markets are having a little bit of a rally, so that's good.
I suppose. Okay. Well, let's talk a little bit about where we are in the Coachella Valley and Riverside County um, in context of the bigger picture of coronavirus. What you'll see here is yesterday's report from Riverside County on our county level cases. They went to a weekly report on the Coachella Valley specific numbers, so we probably won't have that out until later today. It wasn't up as of about 5 minutes ago. But what you'll see here is a continued increase in our case numbers over the last week, reflective of the increasing number of cases that we've been seeing statewide as well as nationwide. And so we saw, nowhere near as many as we had last year during the surge when we were up around 4,000 a day, but we definitely have increased now up to somewhere in the 1,000. So our hospitalized patients, we continue to see those numbers also creep up. Again, nowhere as high as they used to be, but we were down to like 100 patients in the hospital with COVID in the county, and now we're back up to around 475 and 87 in the ICU. And there was a point where we had, I think our ICU numbers were less than 10. So that's a little bit concerning, especially as you'll see that our cases actually haven't really peaked yet. So if we're going to see a much higher peak than this, we anticipate down the road to also see those hospitalized numbers go up further. So let's go all the way to the bottom. And again, we're going to look here at our positivity
Eek.
rates. I know, it's kind of
Sorry, it's my
disturbing.
first time seeing it today.
Yeah. It's like, right. And the graph actually is the same graph they had up last week, which is funny to me. But you'll see that our positivity rates are still going up. Um, we've got this August 3rd number of 11.7, but our current rates is like around 12.5 on positivity. So that's continuing to creep up. So that is sort of it for that particular graphic. So Dr. Kim, I wanted to talk a little bit about, some recent stuff that people have been asking us questions about. We're
Sure.
getting people who are talking about, things they've seen or videos online and questions they have about whether our current approach to try to control this is even working, So what did you want to address first, like a concern that you've heard?
Right. So I think in this link, if you go down a little bit more, there's an animation right there. And so before we play that, we'll kind of talk about this. This shows what happens when you start with a population that's 30% vaccinated out of 10 million people, and they're exposed to the Delta virus. Why are there breakthrough infections? Why does it look like it's more than the unvaccinated. And I don't know if you want to talk about that or.
Yeah. Well, let's take one step back. Um, I I want to spend just 30 seconds on why the Delta variant is different.
Okay.
So way back in the middle, at the beginning of the pandemic, we talked about this thing called an R naught, or an R with a little zero on it. And what that means is, in a population where nobody's immune at all to whatever it is, how many people will one person infect if they come down with it? So this number tells us how contagious something is, basically. Measles is a horribly contagious virus, and its R naught is something like 15. So that means for every person who catches measles, they'll give it to 15 people if no one's immune. Chickenpox is around 10. And these two viruses have something unique about them, which is that they can travel like through air vents, like across a huge room or like football stadium, and infect somebody 30 minutes later on the other side. Okay. COVID's not like that. It's more of a big droplet carried thing, more like influenza. The R naught for influenza is between 1 and 2. So each one person with flu in general infects between 1 or 2 other people. For the original COVID-19 strain, the R naught was between 2 and 3. So it was like twice as contagious as COVID, and as the flu. And so it was a little bit harder to control. And we saw that with all of our masking and stuff last year. We decimated the flu. Like, we had no flu. The COVID still was able to spread, even with some of the things that were put into place. And then Delta variant came along, and the R naught value for Delta is between 6 and 7. So it's much, much more contagious than the original COVID, and tons more contagious than the original flu. But it still doesn't travel across the stadium 30 minutes later and infect people on the other side. That it doesn't do that. Right.
And I think if you pull up one of the other, Jeff.
Well, do you want to go to that yet?
Well, no, there's an actual slide that shows.
Yeah, I know, but let's get to that later.
Well, no, that's what you just talked about.
Oh, okay. So it's the slide with the people with the masks, I think.
Yeah.
Is that the one?
Yeah, if you can pull that up, Jeff. Not that one. The other one. Nope. Oh, did we not? Maybe we didn't send it. I thought we sent it. Anyhow.
So we won't talk about that one. But that one was kind of cool because it showed that, basically just by putting a simple mask on, we cut down on those big droplets, right, and it helps to prevent it from spreading. But let's go back to the original.
Oh, there it is.
Yeah. So you'll see here at the top, you got that close contact, and that's where COVID sits. It's in one of those viruses that needs people to be fairly close together for a period of time to get infected.
Right. So the yellow orangey dude or dudette is the infected person.
Right.
And it's showing the 3 major ways, not for COVID, but just a respiratory virus and how it can spread.
And then underneath it, you have an airborne virus, and these are things like chickenpox and measles.
Right.
And those, you don't have to be as close, and you can even have a barrier between you, but because it's in these teeny tiny little particles, it'll just kind of stay floating in the air for longer. Right. So the airborne viruses are much, much more contagious. And then fomite at the bottom. Fomite just means a surface or something that's gotten contaminated that somebody else comes along and touches. And surface viruses, oh gosh,
cold.
The common cold is a real typical pink eye,
Right.
that kind of thing.
And so right next to it, when you see the two white heads and they're touching, it just shows that actually people who are sick can get themselves sick again. You can re-inoculate
Is that
yourself.
what that means?
Yeah.
Yeah, that's lame.
But
I hate
anyway.
that. Yeah. Okay.
But anyway, this shows, so with the COVID virus, though, really the top portion is what we're trying to do. There is some data suggests there's minimal fomite, right?
Yeah, it's really not where.
Right. So even though washing surfaces is still good because it catches a lot of other things,
Yeah,
it's probably not the bang for the buck for the COVID. Isn't that what you would agree?
Yeah, in fact, I was just looking and I hadn't found a single case where they had documented fomite transmission. So it's really not where the problem is.
Right.
Okay, so let's go back to the other slide.
You want to go back to the animation?
Yeah.
Okay.
We got on a rabbit trail with my R knot. Sorry about that. Okay, so what this animation is going to show.
Not this one,
the other one. Let's see. That one, yeah. Okay. So what this is going to show is that when you have a small amount of your population vaccinated, Delta occurs and causes a lot of hospitalizations. But as you increase the percentage of the people who are vaccinated, you still have cases of Delta, but the number of hospitalizations that you have shrinks dramatically. And the higher the amount of vaccinated people you have, the more of those breakthrough cases tend to represent more of the disease. But
so right now it's showing if 30% of a population of 10 million people are exposed to Delta, you might get.
Yeah, and the red dot is going to be cases of people who are vaccinated, and then the big gray dot is going to be the hospitalizations of people who are not vaccinated.
Right, and so as you watch the video, you'll see what happens as the vaccination percentage increases. You'll see what happens.
So we're now at 50% vaccinations, 60-70. That's about where we are now. And so that sort of gives you an idea of, the greater number we have of our population vaccinated, the more cases of breakthrough COVID we're going to be seeing, because there are just more people who are in that category.
Right.
But the total number of hospitalizations is shrinking dramatically. So thinking about that is helpful, I think. When you hear stories in the media or something about, oh, there was an outbreak and 50% of the people or 70% of the people were already vaccinated, what does that really mean? And so that's part of what the next slide is also going to show. So let's go to
no, the next slide, not
this one. So at an 83% vaccination rate, and if you hear, they had, 50% or 70% of the cases were among vaccinated people, and you start to think, gosh, maybe the vaccine doesn't work. But really what you're looking at is you're comparing apples and oranges, because the two groups are not the same size. So this is an example of that. There was an outbreak in Massachusetts where, 74% of the cases were among vaccinated people. However, there wasn't an overrun hospital situation at all. Those people didn't go to the hospital. And it was in a community where they had a lot of those people had come in from out of town for an event. But there was also a very high local vaccination rate. It was it was really, I think, closer to 90% of the community had been vaccinated.
Well, I'm going to explain this slide first, and then you can talk about that situation
Okay.
so we don't get people confused. So this,
Too late. Okay.
let's pretend this is a community that has 83% vaccination rate and 100 people live there. And let's say in the month of July, 4 cases of COVID occurred, 2 in the vaccinated and 2 in the unvaccinated. Well, you could say 50% of the cases occurred in the vaccinated, which is true. 2 out of 4 is 50%, 2 out of the vaccinated. And so people can believe, oh, well, the vaccine is no better than 50-50.
Yeah.
That's really not the case, because what you're looking at is 2 out of the 83, that's only about a 2% rate, versus 2 out of the 12, that's about a 13% rate. So looking at that way, like Dr. Burris said, you can see how well the vaccine performed. So then we're going to talk about an actual real life event Dr. Burris was talking about.
Yeah. That. So there was an outbreak. This is the one in Massachusetts that changed the policy on wearing masks indoors for vaccinated people. And what happened was there was an outbreak of around 700 cases in a town that was highly vaccinated, around 90% plus. And they're like, 700 cases in all these vaccinated people, that's horrible. And it gave us a little bit of pause, because this is, towards the beginning of our experience with Delta variant, and we're like, what does this actually mean? And that's why they backtracked and decided to recommend that even vaccinated people start wearing masks in crowds or indoors, because they saw, A, they can still get it, and B, they can still spread it. So, but if you look at the actual protection that those people had, when you looked at the denominators, they were still fairly well protected against even catching COVID in the first place. So the number of people who got sick amongst the large number of people who were vaccinated was less than half of the rate of the people who had not been vaccinated. So it still did really help decrease the number of total cases to have that many people vaccinated. But as we are seeing, it's not bulletproof. It's not 100%. So right. We're back to our Swiss cheese model of one thing alone doesn't give you control over the virus spreading. It's not just one thing that's going to end the pandemic. This pandemic is probably going to run its course over the next 3 to 5 years around the world. Vaccines will shorten it. Masks will lessen the disease burden on society. But this is kind of the natural history of a respiratory virus.
Right. And I think you said something interesting the other day that people don't remember. I know we've talked about this before, that the vaccine ideally in a utopian society would eradicate, right?
Right.
But that's not our goal, right? What is our goal with this vaccine?
Our goal is to, A, lessen the number of cases, B, decrease the number of people who are sick enough to either end up in the hospital or die. And a secondary goal is also to allow society to function more normally, because the healthcare system is not overwhelmed and we're not having huge personal cost to people being able to go about their normal business. So we have been, this whole 2 years has been a pretty decent object lesson of these principles of, how everything is connected, how our social structure is connected to our economy, is connected to our mental health, is connected to our children's education and futures. And we're just so much more interconnected than I think people really appreciated. And so vaccines are part of it. Paying attention to what the current situation is with transmission levels, and then putting into place reasonable precautions to help bring transmission levels down when they're high.
Right. So I kind of look at it now like before in the beginning, we were all on the same ship and we didn't know what was going on, and it was ravaging this huge ship. And now kind of the tide has turned where now I would say we're maybe getting to where more people are vaccinated, or at least the more vulnerable, so that it's not like we're afraid that all the vulnerable people and all the hospitals are going to get overwhelmed like it was before. But the balances are kind of shifting back toward that. And I feel like, if you've been vaccinated and you're doing all the Swiss cheese, you have a really good chance of doing well and not spreading it. And if you're not, then you're still in that same kind of risk. But that's kind of a teeter-totter, right? Because we can certainly get worse variants out there.
Yeah. Well, and I think, some of our parts of our country that had lower vaccination rates, not low, they were like 40s to 50s, have been just really suffering with very high hospitalization and death rates. And I think that if we hadn't made the progress we had with especially our elderly population at this point, Delta would have been disastrous. We would have already lost probably another 200,000 people. So even though I look at these numbers and I, get a little nervous for certain areas of the country, and I look at our numbers and they're going up, if this had hit us before we had the level of protection that we have right now, even though it's not perfect, this would have been so much worse, and we would have definitely been shut down again.
Right.
So I think that, if there is a silver lining to this, it's recognizing that all the effort that went into developing those vaccines, getting them out, prioritizing them, and making the effort to try to get people vaccinated quickly saved us.
Right.
Yeah.
I think the other thing that was telling to me is that video out of Louisiana from LSU, right? We both trained in New Orleans at Tulane, but we rotated in the LSU hospital, in the charity hospital in Tulane. And they're one of the hardest hits, if not the hardest hit community, right? In their hospital, they said 78 of their ICU beds are just pure COVID. And that's a quarter of their ICU beds. This is the largest hospital in New Orleans or Louisiana. And so, what was striking was the doctor saying that no one disease should take up 0.25% of your ICU beds, right? It should be.
No, it was half the ICU beds.
Yeah.
It was a quarter of the beds in the entire hospital.
Oh, that's right.
Yeah.
So, maybe 1%, 2% for a disease like this should take up your ICU at most. And so, as she's driving home, she's wondering, the physician is wondering, I hope the trauma doesn't come through. I hope a heart attack doesn't come through, a stroke that needs the ICU bed, because
we don't want
ERs are backed up all over Louisiana trying to send people, not COVID, but other. And so, that's what we're trying to prevent everywhere else. Now, it's not happening everywhere, but there are communities, like you said, that are getting devastated. So,
and I honestly don't think we're going to end up quite like that.
No.
Yeah. Our local vaccine numbers are high enough that I think we're protected against that level of overwhelmed healthcare system. But we are going to see, I think, over the next month, a stressor put back on the health system that hasn't been on it for a few months. And, be kind to your ICU nurse friends. If you know any, reach out and
for me, the one
send them some coffee or something.
For sure.
Yeah.
The one worrisome thing is that our pediatric ICU here is very, very small.
Small.
1, 2, 3, 4 people, and then it overwhelms the system. So that has me a little worried for our community because we don't have a large pediatric ICU here.
Right. And normally what happens is you send those kids out to the local pediatric hospitals in Southern Chalk or Loma Linda or Rady down in San Diego. But what happens is when those hospitals are full, we can't send our kids to them. So our kids don't get to go to the hospital where the pediatric subspecialists are working. And so just, yeah, we are probably not going to end up with 40 kids in the hospital. But even if we end up with 5, that'll be 5 that should have been at a subspecialty hospital that probably won't be able to get transferred.
Well, unrelatedly, I called Rady's for an inpatient admission, not COVID related. And they told me we're not taking any out of San Diego County admissions right now because our hospitals are getting full of RSV and COVID admissions because there's a big RSV outbreak for kids. And so it's already happening. They're not accepting someone that they could have accepted, not saying they would have, but because they don't live in San Diego County, they're absolutely not even considering that.
Yeah, so they're already starting to limit their transfers in, and we haven't even hit.
Right.
School hasn't even started.
Anyway, so that's the one thing I'm worried about a little bit.
Not, a little bit. Yeah. It's it's not going to affect a lot of people, but it will affect somebody.
Yeah. So in any case, I know we went along again, and so I apologize. So we probably should jump on to our next show, Your Health. But I wanted to talk about some things that are out there right now and talk about some points that people are asking us about vaccines and whatnot. So again, right, our message is if you can get vaccinated, continue to social distance, especially in certain situations. In other situations, you don't have to do so much, but be careful because Delta is increasing.
And apparently, if you have the opportunity to take statistics in high school or college, you should take advantage of it because it's going to be necessary, apparently, for understanding Facebook. Yes. Okay.
All right, everyone. Thank you so much, and we'll see you next week.